Hello, I'm Dr. Tommy McGee, and I want to show you how we're using some really super cool 3D digital technology to plan and place our dental implants today. I'm Smile Solutions in Scottsboro, Alabama. You can find us on the web at smilescottsboro.com. The heart of our 3D planning is a dental CT scan. This is a dental CT scan. It allows us to focus in on specific areas of concern so that we can safely plan your case. This young man has lost 3 key teeth and he wants to replace them with dental implants. The first thing we're going to do is identify vital structures, in this case the mandibular nerve. Don't want to get in the way of that one. So we trace it on one side through a series of steps, and then in a similar manner trace it on the other side so that we have a bilateral view of the mandibular nerve. We need to be constantly aware of where that nerve is so we don't encroach upon it with any of our instrumentation or implants. A dental CT shows bone and teeth, but we need to see an actual representation of the patient's mouth. So in that case, we're going to import a digital impression called an STL file. Once we import the STL file, we have to align it with the CT. We do this by identifying common points of anatomy on both. Watch closely. There it is, perfectly aligned. Now we can plan the case as if this were the patient's mouth and not an X-ray. So if we want to know where to put our implants and what angle to place our implants, the first thing we need to do is know where the teeth are in their proper size. So we place virtual teeth and then we tweak their alignment and size, get them in the perfect position so we know where to place our implants. After we place the first tooth, we place the other teeth in a similar manner. Okay, great. Now that we know where the teeth go, we can plan our dental implants. We drop them in place and then we tweak the position. This is where most of our time in planning is spent. Once we have the position right on the first one, we plan the others in similar fashion. Now we're ready to create a surgical guide. We enter some specific information, then we outline our guide, make some adjustments, create windows so we can know that it's properly seated in the mouth, and we create the surgical guide which fits over the patient's teeth and guides our instrumentation. The guide is then exported and printed on a 3D printer. Here's a simulation. Once the guide is printed, we use it to place the implants. Here's another view. Now if we take away the lower jaw, we can see where the implants were planned. And by superimposing the post-operative CT scan, we can see where they actually ended up. I'd say that's a pretty accurate result, and the whole time we avoided any injury to the mandibular nerve. Here's the final result with the crowns on the implants. Now this patient is restored to full form and function. Thank you for watching.